Hello, hello, friends. Good morning, good afternoon, good evening. Wherever you are coming from, welcome to Dr. Ajay Vibes. So, characteristic symptoms are the doorway to homeopathy. That's a topic today. Last week we discussed elements of symptoms, types of symptoms, and you may be wondering, hey doc, why should I need to know all this stuff? As I said before, it is very important for a successful homeopathic prescription. The role the person plays is far even better, more important than the role actually played by a practitioner, a doctor, a physician. Because homeopathy is based on symptomatology. So, symptoms are something you observe for yourself and convey it to your practitioner. So, better you do that, the better you will be helped by the physician, right? So, it's very important. Oftentimes, even I felt when I was consulting people, and I thought this is something everyone should be aware of before they see a homeopath. That is the reason I started with this topic, what you need to know before you see a homeopath. Because when you are aware of this, maybe jot it down on a piece of paper. Sometimes many homeopaths these days, they use a questionnaire, right? So when you fill out the questionnaire, you are thinking, you are reviewing in your own mind, you are trying to remember, right? Relate with yourself, put it on a piece of paper, on a questionnaire, or maybe electronic on computer. So what happens, it helps you to give better picture of yourself to your practitioner. So that is the whole idea of doing these videos. So if you haven't watched my video, homeopathic video from last week, where I discussed elements of symptoms and types of symptoms, please do go and watch it even before you watch this video, because it is important you understand and follow up with this information what I am providing. You are well prepared, better prepared when you see a homeopath. If you have to see a homeopath or a doctor, a practitioner, and you are better prepared, well prepared, so that they can help you far better way. Okay, so today topic is characteristics. What are the characteristics? What is a characteristic, right? Now these are a type of symptomatology that gives the symptoms that are very unique to you as a person, right? What is unique to you, not common to disease or problem or ailment, whatever you are visiting your practitioner for. They are called common symptomatology. The characteristics are very unique. If someone else is having same problem as you, they may not have these characteristics. But the problem is the same. The common symptoms, the pathology, the condition, disease condition is the same. But these unique features, the characteristics, which are very specific to you. So these are known as very uncommon, peculiar, unusual, rare, strange, striking, and remarkable symptomatology. So these symptoms, any of these characteristics, specific characteristics, are found in only few people, very specific to them, and only in a few provings of medicines. Right, in homeopathy they do provings, right? As we discussed in very first video, they give these substances to very healthy human beings, and that's how they do the provings of homeopathic medicines. We will go into all these topics again and again with more details in the coming videos for a long time. So these symptoms are unexplainable. You can't explain it through any pathology, any health issue you are going through. It is not related, right? That's why they are strange, rare kind, remarkable, unique, right? Uncommon, those sort of symptoms, right? So you can't, because of so and so thing happening, the pathology. I mean, you have to use medical terms here, unfortunately, some of them. But these videos I am doing to develop general awareness among my friends, people who watch these videos, develop understanding of homeopathy, awareness. I call them homeopathic awareness videos, basically. Right? Of course, this helps homeopathic profession as well. People like me. And it's a great, even I go back and look at them. It's a good even reminder for me as well. Right? So, but the main idea, the sole idea of these videos is everyday people like you and me, right? To give some homeopathic awareness. So these are unexplainable through any pathology or disease condition, right? They characterizes, individualizes, and distinguishes, differentiates from one person to another person, one medicine to another medicine. They are unique to medicine, a single medicine or a group of medicines sometimes, and very unique to a person. Sometimes maybe a few people may have, of course, people could be having similar characteristic symptoms time to time. That's a possibility. So what are the characteristic symptoms? They are rare, uncommon. They are not common to pathology or disease, right? Many people are having same problem, but these are uncommon. They vary from person to person. So these are uncommon, peculiar, unusual, rare, strange, striking, and remarkable symptoms. Those are the characteristic symptoms unique to a person, unique to you, unique to me, unique to anyone. It differentiates from person to person. So they are unexplainable, no explanation behind them, often unexplainable. They characterizes, individualizes, differentiates from person to person, from you to me, from you and me to someone else. Every person in the group having same problem, for example, flu, let's say flu. or a headache, or some gastric problem or a respiratory problem. We are going into some examples of characteristic symptoms very soon. But any of these conditions, but these characteristic features vary from person to person to person. That's how they all get different medicines in homeopathy. So a group of people, they put in a room, they are having same pathology, same ailment, same problem. I'm trying to avoid medical terminology as much as possible because these videos are for everyday people, right? So but I'm struggling to do that. It's easy to use medical terminology, right? Than otherwise. So these are unique to person, each individual, each person, right? We will go into examples in a minute. But before that, these are uncommon characteristics, right? Let's look at what are the common symptoms. Some example. We all know that common symptomatology. But so let's have a look at that first. So common symptoms: loss of appetite. Hey doc, I don't feel like eating at all. Not hungry these days. It's a common symptom, right? It doesn't help much. It does time to time. But value wise, less value because we are looking at characteristic symptoms, right? So, loss of appetite, headache is just a vague symptom, a common symptom. Headache, right? Unwell, uneasiness, disturbed sleep, discomfort in the body, maybe pains in the joints, so on and so forth. Respiratory problem, little cough, little difficulty with breathing, dyspnea, we call it. These are some of the examples of common. Anything you can think of. For example, whatever health issues or diseases. Again, I am trying to avoid some terminology. But anyway, we have to use some. So any of the ailments you are used to, or the family members, they routinely they have headaches, migraines, sinus problems, gastric problems, respiratory, lungs issues, or problems in the joints, pain. The most common things. Every person will have in that condition. Every person will have same symptoms. Now, those are not much useful here. They are the common symptoms, just some examples. But let's go a little more detail into some examples for these characteristics: uncommon, peculiar, unusual, rare, strange, striking, and remarkable symptoms, the unique symptoms. We will go into some examples. But before we go into that, my dear friends, this video, as I put it in the disclaimer, is only for educational purposes, not to be taken for any advice, a medical advice, health advice for any specific person, individual, or you, my friends. This is only for educational purposes. So let's go through some of the characteristic symptoms: uncommon, peculiar, unusual, rare, strange, striking, and remarkable symptoms, unique symptoms. Let's go through some of the examples very, very fast. I will give the symptom, the characteristic symptom, then the medicine, the homeopathic medicine, which one covers that. So to give some understanding some idea of characteristic symptoms as well as the scope of homeopathy, what sort of scope is available in homeopathic system of medicine, and this gives a very good information. Let's go through this information very fast. Burning better by heat. Look at that contradiction, the burning, right? When you have burning pain, usually it gets relieved by cold application, cold water or something cold you are applying, burning gets relieved. But here, the burning sensation gets relieved by heat, hot application, warmth. Thus, a type of a peculiar symptom is covered by a homeopathic medicine called arsenicum album. So it is basically the arsenic, you and me, we all know that, but it is prepared as per homeopathic pharmacopoeia. So basically it doesn't contain hardly any even a molecule. It has the energy print within that medicine. We'll go into that. That's a different subject altogether again. We'll go into that. But anyway, these are the homeopathic medicines. So arsenicum album is one of the very popular homeopathic medicine. Those of my friends of homeopathic profession here who are watching, everyone familiar with this common, very usually prescribed medicine, arsenicum album. So the burning pains better by heat. That's very peculiar, uncommon symptoms. Craves milk with skin, flu and rheumatic symptoms. So these are like rheumatic symptom, skin symptoms like flu, and they crave for what? Cold milk. Now, where is the relation between those two conditions, right? So this is very peculiar, sort of striking. It can go under striking. It can go under peculiar. Sort of, they can go under one category of those uncommon, peculiar, unusual, rare, strange, striking, and remarkable symptoms. One category, or they could go under several of those categories. Doesn't matter, right? So abdomen is empty. Your tummy is always empty, even after you had a full meal, whatever, biryani in India or a burger here or pasta, whatever right? You had a full meal, but within minutes you feel your abdomen is empty, right? So that is a indication, a characteristic, peculiar symptom of phosphorus. It is again the phosphorus, you and me, we all know, but this is a homeopathic preparation, prepared a homeopathic way. So it's different, completely different. There is no molecule of phosphorus in at all, only energy print within it, right? So that phosphorus contains this strange symptom, abdomen is empty even after eating full, right? Heart pain extending to occipit. Occipit is the back area here in the head. So usually heart pain, my friends, if you have any of this sort of issue, you have to see your doctors, okay? This is only, again, I want to make sure this is just educational to provide some awareness, okay? So this is something serious we are talking about. So if there is some heart pain, usually it radiates, extends into left arm, right? It goes down the left arm or goes into neck area, right, over there. But here is a very uncommon, strange. If someone is having a heart episode, but they are having more here than even the local area, cardiac area. So they are having pain in the occipital region. So that is an example for two medicines in homeopathy, gelsemium and spigelia. Right? These are homeopathic preparations of gelsemium and spigelia, where you see this heart pain extends to back of your head. Delusions that animals are under your bed. Look at, we were talking about delusions yesterday, or I mean in the last video, I think, right? So delusions people are having. There are some animals under bed. They hear, even maybe they hear some sounds of animals, but there is nothing there, right? So that sort of symptom is in a medicine called chamomilla, homeopathic remedy, homeopathic preparation, chamomilla. When it is proven, people developed this sort of symptoms, as well as in the clinical practice, when this is applied to the sort of symptomatology, characteristic symptom, it is noted people got relief from that delusion, right? Thirstlessness during fever. So usually when you have fever, fever is heat, right? We are thirsty. So everyone wants to drink water, but in some cases, there is no thirst at all. High temperature running for days, maybe weeks, right? Maybe a typhoid fever. In countries like India, we see more typhoid, right? Or it could be a malarial fever. So, but there is no thirst. Even in summer, hot summer, no thirst. That's a very peculiar, strange symptom. A characteristic points towards two medicines, Apis mellifica and pulsatilla in homeopathy, right? Those two medicines have this remarkable symptom, silent grief. Usually with grief, people may have, the episode not really very silent, but of course there are silent griefs as well. So this is silent grief, solitude. They prefer solitude, ignitia. Again, a homeopathic preparation, homeopathic medicine, ignitia. They prefer solitude with grief. Pain improved by motion. Now look at this contradiction. Usually if you have some pain, you would like to just sit, because if you move, the pain gets aggravated, pain increases. But here in this situation, the characteristic pain improved by motion. The medicine is rue stocks. The homeopathic preparation rue stocks has that condition, that characteristic, peculiar, uncommon symptom where any sort of pain, pain in the joints, pain, headache, or any pain, on the contrary, it improves on the motion, on the go. So a person has to keep moving around so that they get relief. And the medicine, most common medicine is rue stocks, homeopathic preparation, right? Feeling the bed is too hard. Someone is having fever, or they have to lay down. They feel even on a soft bed, they feel the bed is very, very hard, right? That's a peculiar symptom in medicines like baptisia, pyrogenum. These are homeopathic preparations, has this characteristic symptom where they feel bed, even the soft bed, is very, very hard, right? Pain moves rapidly from place to place. So someone is in your consulting room, they say, hey doc, I have pain here. In a minute they says, hey doc, now pain is here, not there. then it keeps on moving various places. I have seen this characteristic in my own practice, right? So they move from place to place, changes. These are rheumatic pains, right? But they are changing location one place to other. So there is a medicine in homeopathy called lac caninum. Now that has this characteristic symptom where pain moves rapidly from place to place. 11 a.m. hunger. So say, hey doc, what? Wherever I am at 11 o'clock, if I am feeling hungry, look at my watch, it is about 11 o'clock. Always. That is very specific, very unique, very characteristic feature of a medicine called sulfur. We all know sulfur, you and me, we all know sulfur. It's a common chemical. But this is homeopathic preparation, not just sulfur in the chemist shop, okay? Same stuff, but prepared homeopathically, so it becomes a homeopathic medicine. And that particular preparation has, when given to healthy human beings, they developed this symptom, right? We go into more of this sort of subject in the later videos, but here for a example, for a characteristic symptoms, at exactly at 11 o'clock, if people are developing hungry, it is sulfur. 4 to 8 p.m. aggravation means evening from 4 o'clock to 8 o'clock, whatever is the problem, gastric problem, respiratory problem, headache, could be rheumatic problems, joint pains, whatever, it doesn't matter which problem. The problem increases at 4 o'clock, it goes until 8 p.m. in the evening. That is the most characteristic symptom of a medicine, homeopathic preparation called lycopodium. So in lycopodium, in preparation, the symptom or whatever is the problem, they increase from 4 p.m. to 8 p.m. I hope you are getting some idea of characteristic, unique, peculiar symptomatology, right? In general medicine, for example, 11 o'clock hunger, problems increasing 4 to 8 p.m., probably not much useful in general medicine, right? But when it comes to homeopathy, they are the peculiar, rare, unusual characteristics that really point towards specific homeopathic preparations. So, before I have a few more examples, but anyway, time is short. Let's cut it down as much as possible. So one may feel awkward, ashamed, absurd to recollect these symptoms, right? I mean, sometimes there are situations, people say, hey doc, do you need all? Sometimes when they are irrelevant, complete, they come for something else, but going through these symptoms, usually they may say that, or they may come out because of your interrogation, you are eliciting symptomatology out of them. Sometimes they feel awkward. In what way this is related in homeopathy? That is the only related, that is the only important thing. As we discussed characteristics actually are the doorway to homeopathy. And if you have some good characteristics, you feel you are lucky, because you will find excellent medicines in homeopathy. Sometimes, many times, we go over cases, we don't find characteristics, not much useful information for homeopathy, just routine symptomatology, the diagnosis, pathology. I mean, they help as well incredibly time to time, but sometimes these characteristics are very important. Sometimes homeopaths, they take one consultation, two consultations, you need to come back again, because they are trying to find some real good characteristic unique features, so that they can help you far better way. Okay, so let's look at very fast few more examples. Daily nose bleed in the morning, arsenicum album again. So every morning they have again, friends, this is only education. Okay, don't try don't go on, because there are so many other factors you have to look for to select a medicine. So this is pure educational, and also to give the idea of scope of homeopathy, what is possible. Okay, so daily, every day, in the morning hours, the nose bleeds. Only morning hours, not any other time. Arsenicum album again. Headache, leaning against anything. If you lean against anything, you suddenly get a headache. It's belladonna, homeopathic preparation. Parotid glands swells at sunset daily. Every day, parotid glands are here, just in front of your ears and under the ear. This is, they look like inverted pyramid sort of shape. They are salivary glands, right? So these salivary glands get inflammation and things happen with them. Sometimes you have pain there, right? Parotid gland inflammation, they swell. Look at this characteristic, only at sunset, every day, right? Whole day the person is fine. In the evening, just about to sunset, they suddenly start feeling the swelling and little pain and uneasiness with saliva, the parotid gland. So what is the medicine? Carbo animalis. That is a homeopathic preparation. Again, homeopathic preparations, these medicines comes with potencies. There are lots of potencies. There are ways to select how your homeopath selects potency. We will go into all that subjects in the coming videos. Okay, so as if a piece of paper in the throat. Again, my friends, very careful if you have this symptom. Okay, as if there is a piece of paper in the throat, usually due to inflammatory conditions, tonsillitis, pharyngitis, throat infections, the sort of problems one may develop. They feel there is a paper stuck in the throat, right? Again, the medicine is carbo animalis. Okay, my friend, these are only, again, awareness purposes only, educational purposes only. There are many other factors we have to consider to select a medicine, but characteristic symptoms are doorway to homeopathy. They are very most prominent, important symptomatology. Okay, sour stomach from tomato soup. Somebody is drinking tomato soup and their stomach goes sour very quickly. Lithium carb is the homeopathic preparation, the medicine, the drug, homeopathic drug, lithium carb. Pain like shingles without eruptions. It feels like shingles, all the symptomatology, but there is no eruptions, no rash at all, but there is pain, right? Ranunculus bulbosa is a wonderful homeopathic medicine that has these peculiar characteristic symptoms. Because if it is a shingles, rash should come out, right? At that stage, when rash has to come out, it has to come out. But here, rash is not coming out. Something is stopping, right? And there is pain, like sometimes it may not be even shingles, but the pain feels like that, right? Ranunculus bulbosa. Menorrhagia means prolonged bleeding in the woman while baby nurses. So baby, feeding baby, breastfeeding time, right? And prolonged discharge, the monthly cycles when they take beer. Look at these characteristic symptoms. So mother is having some beer and what happens? They develop prolonged, extended monthly cycles. The medicine is millifolium. Millifolium. It's one of wonderful homeopathic preparations. So this shows the scope of homeopathy, how homeopathy uses very rare, peculiar, uncommon symptomatology. I mean, all these conditions we gave examples, they will have common symptoms as well, which belongs to that particular condition, disease or entity. But these are characteristic features actually helps a homeopath to find a proper medicine. And if you are aware, these sort of symptoms are very important in homeopathy. You will try to remember, you will ponder over, hey, what sort of unique symptoms I have, because I am going to see homeopath, right? They need characteristics, unique symptoms. So do I have anything uncommon? Sometimes you may even wonder, hey, this is not related to anything. Why do I need to tell a practitioner, a healthcare practitioner, a doctor? But now you realize they are very important in homeopathy. You have to present these characteristic features. Nervousness about ankles. I mean, people feel nervousness in the chest, or maybe in the eyes, or maybe in the head, maybe in the belly, right? Time to time, people feel nervousness. But here, nervousness in the ankles. You know the ankles, right? Just at the end of our leg, around the feet, ankles. So person feels nervous there. So what a peculiar symptom, right? It is covered by a medicine called pulsatilla, a homeopathic preparation. Nausea on rising. Every time you rise, I'm sitting here, I get up, feel nausea. A medicine called bryonia has that characteristic. Has to strain long, even for soft stools. Even a soft stool in the toilet, you have to strain for a long time. The medicine is Calcaria fasi. It has that characteristic symptom. Cough only, lying down. Only when you are lying down, not any other time, walking, sitting, fine. As soon as you lie down, you are coughing. It is a characteristic of a medicine called Hyosamus, homeopathic preparation. Needle-like pains all over left arm. Only left arm, nowhere else. They are needle-like pains, the characteristic. A homeopathic preparation called Kali Carb. Horrid visions, fears in the dark. In the dark, it is sort of a common symptom many times, but it is at intensity, higher intensity. They have these fears. A medicine called stramonium, homeopathic preparation. Heat of vertex with latent eczema. Here on the top of head, there is so much heat is coming out, and it's latent eczema, means you may develop eczema very soon. A wonderful, beautiful, we call it one of the king of Sora. We will go into all that later days. A medicine called sulfur, right? Again, sulfur, we all know, everyone knows sulfur, it is chemical, but this is a homeopathic preparation. There is not even a molecule in there, it's energy. So that develops these symptoms. Sleeps only during violent rocking. So there is a child, the only way you have to put them to sleep is you have to rock them violently, right? Then only they sleep. A medicine called Sina in homeopathy. My friends, the reason for giving all these examples of characteristics is for you to realize the scope of homeopathy, what sort of scope homeopathy has, and also the importance of characteristics in homeopathy, but not to treat, cure, diagnose, or anyone through these videos. It's impossible. As well as now, characteristics, as important as they are, the doorway to homeopathy, there are other stuff that needs to be considered very important. The reason I am saying that, because even with these characteristics, And if you remember my last video, I covered the types of symptoms, physical generals, mind generals. They are very, very important. Physical, whole body symptoms, and mind sort of symptoms. I covered this in my previous homeopathic videos. Please, if you haven't watched it, watch them for some understanding, because along with these characteristic symptoms, when you see your homeopath, you also have to present physical generals, mind generals, right? And various other things. There are things like causation, duration, extension, alternation, right? Bodily tendencies in homeopathy, they are called miasms. We will go into that stuff in the later videos. So the reason I am saying covering these points in the end, because there are lots of other things needs to be considered as important as characteristic symptoms, but there is so much. So it is called totality of signs and symptoms. That is a concept in homeopathy. So a homeopath practitioner looks at totality, the whole picture of a person, but characteristics are extremely important. And you have seen, these are just some examples. There are thousands and thousands and thousands of characteristics, bodily sensations, and so many things we can cover. As we do more and more videos in the future, of course we will be covering some of this stuff again and again. Anyway, so friends, this is all for today. It's a very long video today, and hope it is valuable for your time. Thanks for your time. If you like this content, please like, share, comment, and most importantly, don't forget to subscribe. We will catch up again on another inspirational video early next week, and another homeopathy video following weekend. Have a great day, my friends. Bye for now.